Live from the digital studio inside our Abingdon headquarters, this is CAMEOpod, a podcast production of EO. My name is Zach Oven. I am the Marketing and Communications Coordinator here at EO, and this is our second Community Services Board podcast. Today, we're talking about Planning District 1 Behavioral Health Services and what they offer in Lee, Scott, and Wise counties and the City of Norton. With that said, let's get into the conversation.
Hello, and thank you for listening to EO's Community Service Board podcast. My name is Amelia Bertner, and I'm an Education Coordinator at EO. This is the second in a series of 3 podcasts where we are discussing topics related to community service boards and their services throughout Southwest Virginia. We're bringing on guests from different community service boards in our area who are able to speak to the amazing work that they do. In this podcast, you will hear us refer to community service boards as CSBs. Our guest today is Heather Kraus from Frontier Health Planning District 1 Behavioral Health Services. Welcome, Heather.
Hi, thank you for having me today. It's a pleasure to be here.
We're very excited to have you today. Now, Heather, do you want to tell us a little bit about what you do, what your title is at Planning District 1?
Sure. My name is Heather Kraus. I'm the Vice President of Outpatient and Children's Specialty Services at Frontier Health, which is a nonprofit community agency that Planning District 1 Behavioral Health Services contracts with to provide the behavioral health services in our region. Our service area is Lee, Scott, Wise, and the City of Norton. And our CSB is unique in that Planning District 1 CSB contracts all services with Frontier Health, where most CSBs might contract some of their services. Frontier Health is the provider of all the CSB services in our region.
Yeah, Frontier Health does some great work, and it's great to see, Planning District 1 having so much success in our community. So how long have you worked at PD1?
I've worked with the CSB for a little bit over 25 years, working. Actually, it's the only place that I've ever worked. I fell in love with the work that I do at the CSB. Have a passion for my community, and the work that we do there is just so rewarding. We get to touch lives when people are at their most challenging times in their life, and it's just so rewarding to be able to show compassion, give them hope, and help them better integrate into their community.
Wow. So you've really given a lot of your life to Frontier Health. That's amazing. So thank you for doing that. I know your community definitely appreciates the work that you're doing. So what does your job really consist of?
Well, on a day-to-day basis at the CSB, I'm working to provide oversight of services such as outpatient, our outpatient services, and we have same-day access with outpatient where individuals can walk in during the open access hours and get a full intake. So I oversee those services. I'm also over substance abuse services and children's specialty services. So we have the case management services for children, and we are expanding our children's services a lot recently. We're in the schools, some of the school systems, and also getting ready to open some substance use services for adolescents.
Great. It sounds like you're working a lot with kids and adolescents, and I know that they definitely need that expansion of services because of, we all know after COVID, a lot of mental health needs arose more than they had in the past. So amazing work. It seems like the work that you're doing is extremely needed by this community.
And that's so true. We are still seeing the impacts of a COVID and really the impacts that it's had on our children. And we definitely seeing more acuity with the children that we provide services to, needing a lot of additional services and higher levels of care, unfortunately.
Unfortunately, yeah. Well, thank you for the work that you're doing. So we'll move on now to more about CSBs in general. I know this podcast, we're going to speak about you. We're going to speak about PD1 and the services that they offer, and then also about CSBs and why you think they're important. So last time I spoke with Mike Wade with NRVCS about what CSBs are and what makes them so special to our community. And we were both in agreement that the 6 CSBs we have here in Southwest Virginia play a crucial role in the health and wellness of the region. I've been fortunate enough to work with each of you and see the incredible work you're doing. So I would love to hear your perspective, Heather, on community service boards. So I'll start off by asking, why do you think CSBs are important?
Sure. Well, CSBs are important for many reasons, but I think the primary is the CSB is a single point of entry for publicly funded services in our communities. We offer mental health services, substance use services, and also provide services for people with developmental disabilities. The services that the CSB provide are high quality and able to offer services in people's communities where they are, meeting them where they are. One service that CSBs provide is emergency services. And that is a service where we respond to different places in our community, hospitals, different places when people are experiencing a mental health crisis. And so we're able to touch lives at those moments of difficulty and make sure that people have the supports and services that they need. So that's something that only CSBs offer as far as evaluations when people are in those acute mental health crises. Also, CSBs offer a full comprehensive system of care to support the individuals in the community who have needs. We want to help them become as integrated in their community as possible, linking them to needed services, whether it be medical, social, educational, and any services that we can help them become involved in or better increase their involvement in their community. Really feel like CSBs facilitate a sense of community by helping individuals feel connected to others, accepted for who they are, demonstrate acceptance, and where they know they have the support to move through the difficulty that they're dealing with.
Yeah. That's all wonderful. And I think several of the CSBs actually work in our schools as well. You know, EO is really working on that community schools model. Now, are you all in the schools?
Yes, we do offer services in Lee County school system. We're in all schools in Lee County school system, and we have more recently started providing services in Wise County school system. We're in all the high schools and started expanding this January to some of the middle schools there. So the services that we're able to provide in the schools, we are delivering outpatient services. We're able to offer individual services, offer some groups and opportunities for children to be with other youth who have similar struggles that they do. We've seen such a benefit and the ability to reach youth who were not able to get to our clinics for a variety of barriers, but we've been able to serve additional youth by having those services in our communities.
Yeah, and that's wonderful. We've definitely been able to see some of that work that you do through our community schools grant, where we're trying to make the school the hub of the community. Having those services in the school really helps the child get everything that they need while on the school property.
Being on the school grounds, we know that it has less impact on their academic progress. If they check out to come to our offices for appointments, sometimes they, for whatever reason, aren't able to return. And so in addition to making services available, it has also reduced the impact on their academic progress, where they can have their service and return to their classroom.
The attendance record has probably been a lot better, because I'm sure kids are being checked out for therapy services, for case management services, and sometimes maybe they weren't coming back because it was in the afternoon, and so I could totally see that happening. So I think it is extremely important to have those services on the grounds. So wonderful work that you all are doing. So EO has actually been working with you in another way, and also the other CSBs that we have in the area, to implement the youth risk behavior surveys, where we are truly that just surveying youth risk behaviors in our community. So we've been working with some of the school districts in the area. The school districts we've been participating are Wise, Lee, Norton, who you work with, Pulaski, Giles, Montgomery, Washington, Russell, and Carroll. So 9 school districts have been working with us on this. And surveys have been distributed to the 7th, 9th, and 11th graders in those districts, and they'll be wrapping up actually by the end of April. So EO is going to be taking that data and doing some data analysis after all of the surveys are completed, and we'll be able to distribute regional data about youth risk behaviors by the end of August, actually. So do you think you could tell us a little bit about why that youth risk behavior survey is important in our region?
Sure. It's important to gather data on the needs that we have in our community. Often different entities, the Department of Behavioral Health, or sometimes the Department of Education or Juvenile Justice, are offering grants to be able to offer services, but you have to have the data to support the need in our region. I know with COVID that this survey has not been completed in some time, and I'm thinking that there are some school systems that you named that joined to do that and had not done that in the past. So I'm very excited for all of these school systems to administer the survey so we can have the data that we need to bring additional services that are needed here for our youth.
Absolutely. And we've loved working with you all on this, and we can't wait to see, what that data consists of. And I also can't wait to see in other ways that we can work together, for the betterment of the children in our community, for our community in general. I know I've worked on this grant for about a year now, and a lot of that work has been on the youth risk behavior survey. So I'm excited once this data comes in to see what else we can do, what we can do with that data and help our students.
Yes, it's Amelia, it's been a pleasure working with you all on this project and the other projects that you have. And so I can really identify how the projects that you all have and engaging with CSBs are building partnerships throughout our community. So thank you for all the work that you do.
Of course. Well, thank you for all the work that you do. We're super excited to build these partnerships and learn from you all, really, and try to, help out the community in the best way we can.
Yes, that's what we're all here for.
Great. Well, moving on, let's talk a little bit more about Planning District 1 and what you all offer to the region. So first I'll start, what is PD1's service area?
The service area is Lee, Scott, Wise, and the City of Norton.
Great. So 4 different counties, or 3 counties and 1 city in our community. And that's really a rural area, isn't it?
It is. It's a large geographical area. We do have an outpatient site in the 3 counties, and of course, the City of Norton is within Wise County. Right. So we work to have our offices in the areas that hopefully are easily accessible, and so we're located in our office in Weber City for Scott County. It's located in Jonesville for Lee County. And we're currently located in Big Stone Gap for Wise County in the City of Norton. In the upcoming months, hopefully by summer, we will be moving to a new location. Our location will be in Norton, and we are hoping that will give us more room to operate the additional programs that we're opening, but also would be a little bit more centrally located for the people in Wise County.
Well, it sounds like you're doing a great job at trying to make your services accessible to everyone in that community. I know that sometimes transportation is not so easy, so that sounds wonderful. It sounds like you're easily accessible. So what kind of services can residents in those communities get from you guys?
Well, Planning District 1, we offer a full continuum of services for individuals. As I already mentioned, emergency services. We have a full continuum of care for adults. We have children and adolescent services. We do offer early intervention services for children 0 to 3. We have a prevention team. We provide substance abuse services and services for people with intellectual disabilities. And so we serve the entire age range from birth to geriatric. We do offer traditional services such as outpatient therapy. We have medical and nursing services, case management. And then in addition to that, we offer more intensive services that might be delivered in the homes or at those remote locations that we've already referred to in the school systems, but we have other sites. So we offer some services in jails or court service units. One service that is newer in our system of delivery is our crisis walk-in center that's located in Norton. That's not one of our outpatient sites, but that center is a center where anyone can walk in and can be seen. That is actually open 24 hours.
That's amazing. And it's amazing to hear that you serve, people from birth to geriatric. I know sometimes it's hard to come by services for the elderly. So amazing job, really covering all the bases, the needs of the community. And I know you mentioned transportation as well. I used to work in case management, and I know how difficult that used to be for me to get the clients where they needed to be. So it sounds like you're doing incredible work. And like I said, I've been able to see some of this work that you're doing over the past year. So thank you so much for the services that you all provide.
We're just happy to be in our communities and available. We want to offer as many supports and services as we can to help our communities.
Yeah. And it sounds like that's exactly what you're doing. So how can our community help the work of PD1 and other CSBs?
Yes, communities are very important in the work of the CSB because if we think about the challenges that our community faces, everyone has a need for connection and relationship with others. And so I do feel like that everyone plays a role. We know that mental health issues are reduced when people have the supports that they need. So connection with the community actually promotes recovery. We want our communities to be the voice for those who may not always be able to share those things. Our communities, I think that they could focus on education, advocacy, and awareness. And to expand on that some, our communities need education about mental health and substance use disorders, along with the specific services that CSBs have to offer. Communities understand. We want them to understand more about the disorders and also how these disorders impact the lives of individuals. We want our communities to be aware of social determinants of health that impact these disorders, such as access to health care, access to just basic needs, or possibly exposure to violence or trauma. Communities need to know that they play a vital role in an individual's recovery. Community members can advocate for public policies to protect and improve mental health services or increase access. So services can be expanded into the communities. I think people in our communities can reach out to their legislative representatives to advocate for these things, and I think we'll see a real positive impact on services. Maybe individuals' access to housing, or diversion from the jails for people who have mental health issues. I think that our communities play a role in that advocacy, but also in mental health awareness, to just create a safe space, I think, to talk openly, and anything that a community member could do to reduce stigma and help others know the struggles that people do face.
Well, that's all so wonderful. And I hope you would agree that, our community, our region is so close knit. We focus on, our values are definitely kindness and advocacy and empathy towards one another. So I think, and all my listeners out there might agree as well, that we'd be happy to help advocate for those who may not have a voice, to make that collective choice to be there for the people in most need in our community.
Sure. And one other thing that I think about is community people. I mean, if we could educate them about 988, I mean, we have billboards and things like that now. That's something that's available for individuals now to know that they can text and or call and reach someone live that they can talk to when they're in need.
Right. And for those of you who may not know, 988 is the new suicide hotline number. All you have to do is dial 988 on your phone, just like you would dial 911, and you can speak with a clinician right there on your phone if you're struggling in any type of way.
Yes. Another way that I've thought about people in the community, there are coalitions. We have the CSB has a coalition concerned about our communities, which is a prevention coalition that works to promote building healthy and drug-free communities in our region. And so those meetings are available for anyone to attend, and anyone in the community can be a part of that coalition. So that is another way that you can have a positive impact in your community.
Great. And I know the CSBs around the region, they all have prevention coalitions as well. And I try to attend as many as I can. And they're just wonderful. They're wonderful to community. I know professionals go and attend the meetings. We have doctors, we have principals, we have superintendents, we have teachers, we have gardeners, we have just any community members in those meetings. So they're very helpful in hearing, the voice of the community.
They are. We've also been working to try to engage our youth in the coalition that we have. So working with schools to, I know that there's some grants and opportunities for students in schools to maybe get scholarships in the community service hours. So trying to offer some community service hours for engagement with the coalition and participating. We're excited about that.
Yeah, I think that's a great way to do that. Incentives are always helpful for students. And this is actually where I was going to go next and ask the question, do you have anything you'd like to promote from your CSB? I know you just talked about your coalition. Do you have anything else you'd like to talk about?
Yes, we do have some new services that we're getting ready to be able to offer our community. As we know, the opioid epidemic has had a significant impact on our region and really led the need for substance use services for all ages. And so we have one project that is going to be for the youth of our community, a substance use intensive outpatient program. It's going to serve children ages 13 to 18 with substance abuse or co-occurring problems. And we really want to help our youth discover better alternatives to facing and coping with stress, help them build problem-solving skills, and steer them in a way so they have coping skills that they use. So we do hope to open that in July. That will depend on that Big Stone Gap location, moving to Norton, because our IOP will be there in Big Stone, and that IOP will serve our entire region. We're working with our school systems and courts and other community partners to have transportation for those youth to get to that program, which is a higher level of care, but still community-based, where children would not have to leave their home or go away out of their community to access services. The second project that we have right now is a partnership with Recovery Resources, which is a 501c3 nonprofit organization who supports individuals using an evidence-based recovery housing model. And so the CSB and Frontier Health are partnering with Recovery Resources to open a home in Gate City that will house up to 14 men struggling with substance use or mental health issues. And we want these individuals to be able to have a safe, permanent, and quality housing situation that promotes recovery for them. And we'll be working with them to integrate into the community. There'll be a case manager on site. There'll also be a peer that will be available to those men.
So that sounds like an incredible resource for our community. I'm so excited to see the outcome of that. So how can people get involved with that? How can people reach you, reach PD1?
Sure. Anyone that's interested in any of our services can contact us at one of our offices. I already mentioned their locations, but each of the offices are called Scott County Behavioral Health Services, Lee County Behavioral Health Services, and Wise County Behavioral Health Services. And then our crisis walk-in center is called Hawthorne Place. Okay. That's in Norton.
Well, great. And we'll actually put the addresses, the names, and the phone numbers in the episode description for all our listeners to be able to view and access those services. So EO has been working with the region's CSBs to develop a training/event calendar where info on any CSB events that they'd like to share will be located. So this is hosted on our website, actually, which is eoco.org. behavioralhealth.org under the events section. So in the future, you can see events hosted by PD1 and other CSBs there.
We really appreciate and are glad that you all are able to do that. We had a gambling conference last month, and really feel like that the use of that website and those email bursts of information to folks really got the word out about the first gambling conference that we had in our region.
Yeah, well, we hope it was helpful, and we're excited to see, how our community can access this in the future, and maybe you guys can get some more attendees that way. So we're excited to work with you with that and continue working on that. So Heather, is there anything else you would like to add or comment on?
No, I can't think of anything else today, but just thank you for inviting me to join you today, and excited about the opportunity to talk about CSBs and the work that all CSBs do.
Yeah, well, we appreciate you. And Heather, I just want to say thank you so much for the work that you and your CSB does. It doesn't go unnoticed. So I appreciate you being here, and keep up the great work.
Thank you.
And to all our listeners, thank you for tuning in to EO's CSB podcast, and have a beautiful rest of your day.